Atrial fibrillation, or AFib for short, is the most common cause of heart arrhythmias. Atrial fibrillation often causes an increase in heart rate and can be treated by pacemaker and or the drug Eliquis. Eliquis is given because it's an anti-coagulant or blood thinner because of the increased risk in patients with AFib for blood clots. What else could you do if you have AFib to decrease your risk of blood clotting or to eliminate the AFib, to eliminate the Eliquis, to return to normal heart rate? What factors influence or cause AFib? These are the questions I want to dive into today so that you know that there are things you can do as the patient out there to optimize your health and potentially reverse your atrial fibrillation. And these things are likely to never be addressed by conventional medicine. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So you're suffering with atrial fibrillation, and you're wondering what caused it or what factors could exacerbate it and increase your risk of blood clot. Well, the research shows multiple potential causes to atrial fibrillation and exacerbators to atrial fibrillation. Fundamentally, inflammation is going to be a driver of increased risk of AFib, and inflammation is produced by the immune system. So if you have systemic inflammation, which is body-wide inflammation, and or heart inflammation, that increases your risk of atrial fibrillation. So anything that drives increased immune response and activation and the associated inflammation can increase the AFib risk. What specific things have been tied to increasing AFib risk through that inflammatory response? Well, research shows that celiac disease patients have increased risk of AFib, and so gluten is a known potential driver of AFib. So if you have celiac disease, you're definitely at increased risk. There's not research on PubMed that I can find that says having gluten sensitivity increases your risk of AFib, but clinically, anecdotally in my own practice, I have seen that in AFib patients. I've seen patients with sky-high anti-gliadin antibodies, which gliadin is a protein in gluten, and they have sky-high gliadin antibodies and they have AFib, mind you, a pacemaker and Eliquis as well. And when we removed the gluten, one specific patient ended up coming off the Eliquis. Obviously, he couldn't remove his pacemaker, but his doctor took him off the Eliquis because he was no longer having the AFib exacerbations. So if you have AFib, and even if you don't have celiac disease, but you are consuming gluten, that's a definite consideration for you. Another consideration is that research shows that stomach issues are related to atrial fibrillation, specifically infection with the bacterium Helicobacter pylori. Helicobacter pylori loves to infect the stomach and go in and damage cells in your stomach called the parietal cells. The parietal cells are what make stomach acid for you. Well, when you have an H. pylori infection, your immune system may make antibodies to the H. pylori bacteria, and those antibodies share molecular mimicry with the what are called the hydrogen potassium ATPase pumps of your parietal cells. So the antibodies may drive antiparietal antibodies and stomach autoimmunity, which could lead to pernicious anemia. But also research has found that those stomach antibodies, those hydrogen potassium ATPase antibodies that come as a result of the H. pylori infection, also share similarity with sodium potassium ATPase pumps in the heart. So it's possible if you have an H. pylori infection and you've developed those stomach antibodies that they're cross-reacting with heart antibodies and driving AFib that way. So again, being assessed for an H. pylori infection and the various antibodies would help uncover if your AFib, if you're past the point of figuring out if it was causal, we could still figure out if that H. pylori is present and or those antibodies are present, that you could have an infectious driver of your AFib symptoms and or an autoimmune driver of your AFib symptoms. So we see an interconnectedness between all of this. If we have a stomach infection, that's one way that could drive it. If we have a stomach infection driving autoimmunity, that could drive it. If we consume gluten, driving up inflammation from the immune system, that could drive it. So you want to take a self-assessment if you're a person with AFib and say, am I consuming gluten? Have I been checked for H. pylori infection and autoimmunity? And if you have, then, and you're clear, good, but it's unlikely you have been. So if you haven't been, you need to be checked for those things and address whatever it is that shows up, because there's potential that if gluten is driving yours and you cut out the gluten, you no longer need the Eliquis and maybe you don't have AFib symptoms anymore. There's potential that if you have a silent H. pylori infection and you clear that you no longer have AFib. There's potential that if it's an autoimmune driver and you balance immune system and decrease systemic inflammation, that you no longer experience AFib symptoms. So this is the detective work that I do every day. This is the detective work that functional medicine practitioners across the country are doing daily. If you have not consulted with a functional medicine clinician and you're tired of just taking Eliquis daily for the rest of your life being the only answer that you get, reach out to a functional medicine clinician today and move your way closer to a life at optimal.